about erectile dysfunction. And no, it's not just about old man's problem. Stress, poor sleep habits, anxiety, medical conditions, unhealthy lifestyle, and even emotional struggle can affect sexual performance. So in this video, we will be discussing about erectile dysfunction. We will talk about what erectile dysfunction really is, what are the major causes of it, the common warning signs, the myth that people believe in, and treatment options, right, that are available for erectile dysfunction. And also be talking about when to seek medical help, right? So stay till the end of this video. If you're yet to subscribe to our YouTube channel, please do so. Turn on the notification button so you'll be the first to get notified when we post a new video. Like our post, drop a comment, and feel free to share to your friends, right? So let's get straight into the discussion of today. What is erectile dysfunction? This is the inability to get or maintain an erection firm enough for sexual activity. I take that again. Erectile dysfunction is inability to get or maintain erection firm enough for sexual activity. Now, let's clear something up, right? Having erectile difficulties once in a while is normal, right? Having erection difficulties like maybe once in a week, once in a month is absolutely normal. It can happen because of stress, it can happen because of tiredness or excessive alcohol intake, or maybe you're going through an emotional pressure. But when it becomes frequent or persistent, then it may be a sign of erectile dysfunction. Now, this erectile dysfunction can affect several areas of your life. It can affect your confidence level, it can affect your relationships, it can affect your mental health, most importantly, it can affect your self-esteem, and sometimes it can be an indication of an underlying medical condition. Yes, take that again. It sometimes can be a sign of an underlying medical condition. In fact, some doctors have come to consider that if you have erectile dysfunction frequently, it could be an early warning sign of a heart disease or a circulatory problem. In our previous video, we talked about how your sexual health can actually affect your mental health. We've talked about how your sexual health is a key indicator of how your cardiovascular system is functioning. So doctors have come to consider that if somebody has erectile dysfunction, if a man has erectile dysfunction, it could be an early warning sign of a heart disease or poor circulation, right? Now, what are the causes of erectile dysfunction? We have grouped them into several factors, right? We have the physical factor, which could involve high blood pressure, diabetes, heart disease, obesity, high cholesterol level, low testosterone, smoking, excessive alcohol use, and drug abuse can actually affect your erection, right? Now, why is this important? Because erection depends heavily on a healthy blood flow. So whatever affects your blood flow automatically affects your reproductive system. Anything that damages your blood vessels or nerves can affect your erection, right? Now, we also have the psychological factors. These are factors that are not known to be physical, but they are something that affects your mind. It could be stress, it could be anxiety, it could be depression, sometimes fear of failure, and relationship problems. It has come to be that if a couple actually have relationship issues, the man may find it hard to have an erection, right? Then we also have lifestyle factor. This cannot be overemphasized, right? Because these lifestyle are actually can actually manifest as well as physical factors, right? So this lifestyle include lack of sleep, poor diet, physical inactivity, and chronic stress can also contribute to this, right? Now, what are the common signs of erectile dysfunction? How would you, as a man, know that you have erectile dysfunction? Number one is difficulty getting an erection. You find it very hard. No matter what is happening around you, no matter the seduction going around you, you find it hard to actually have an erection. And there is one key thing you should also notice that as a male, it is expected that early hours of the day, like let's say 5 a.m., 6 a.m., you should have an erection. That's what actually shows that you are a healthy male. Whether there is a stimuli or not, you're supposed to have an erection in the earliest hours of the day. That's actually a proof that you are a healthy male, right? So if you're not experiencing this, it could be that you are having a sign of erectile dysfunction. The next is trouble maintaining an erection. Then reduced sexual desires could also be a sign. Anxiety before intimacy, avoiding sexual activity due to fear or embarrassment could be a sign. Now we are going over to the myth that people believe when it has to do with erectile dysfunction. Many believe it means a man is weak, right? That is absolutely false, because not having erection could happen to anyone, whether you're strong or not. It could occur to you at any stage in your life, right? Some believe it's only something that affects older men. right? But I bet you that if you want to carry out a statistics, you realize that there are many young men out there who are suffering of erectile dysfunction and are keeping quiet about it. They're actually silent about it. Why? Because society has made it feel like having these problems exposes you to be a weak man, brings you out of the society as a weak man, right? No, these are things that could happen to you at any stage in life. The next thing is herbal mixtures can cure everything. I have said this in a previous video. If something is not prescribed by a doctor, you should be very careful about it. A certified doctor has to tell you, oh, this is actually good, right? So you should be very, very careful because some herbal mixtures are very, very toxic to our health. And without proper dosage, you may not actually know what you're taking. You may not actually know what is mixed inside of it. You just go ahead and take it, which you're trying to correct erectile dysfunction and you end up damaging something greater than that, right? So you should be careful. The next is erectile dysfunction is always psychological. Many persons believe that this is as a result of psychological issues like stress and anxiety, right? Not that we are reading out the psychological aspect, but it's not always caused by this. We have mentioned physical factors like high blood pressure, diabetes, heart disease can actually expose you because, like we said in our previous video and at the beginning of this video, that your cardiovascular system plays a vital role in your reproductive system. So whenever there is something wrong with your reproductive system, it's a link that your cardiovascular system has a malfunction, right? Now, how is erectile dysfunction treated? How is it treated? Now, treatment depends on what is causing it, the underlying causes. So, if the cause is lifestyle, probably you're not indulging in adequate sleep. You know you have to change your lifestyle. Probably you're not physically active as a man. You have to change those lifestyles. So number one, we have lifestyle changes, regular exercise, eating healthy diet, weight management, reducing alcohol intake. Alcohol has a lot of damage to the body. I keep saying it and telling persons around me that there's nothing you're actually gaining from taking alcohol. Why? Because the food we already eat has alcohol in it. Carbohydrates contains alcohol. When it is being processed in the body, it has alcohol in it, right? Now you already have a lot of carbohydrate. You're eating curry, you're eating rice, you're eating fufu. A lot of carbohydrate is being stored in your body. And then you still go back to take alcohol. You're adding more. It becomes excess. It becomes more than your body requirement, which automatically becomes a problem, right? Then quit smoking, proper sleep, and then managing medical conditions, right? Now we've mentioned several medical conditions that can expose you to erectile dysfunction like hypertension. So you have to monitor your blood level, your blood sugar level as well in case you have diabetes. This would actually help you to control or to manage erectile dysfunction. Then you can also go for therapy and counseling in a situation where it is relationship problems that is exposing you to this erectile dysfunction. You can actually go for therapy, speak to your therapist, and the therapist will be able to help you out, right? And medications as well. Now, when we talk about medication, there's no actual medication for the cure of erectile dysfunction, but we can use medication to manage medical conditions. Now, whenever medical condition is exposing you to erectile dysfunction, you can actually use medications to treat that, right? When should you see a doctor? When erectile dysfunction happens frequently, when it affects your mental health, when you have diabetes or heart disease, you should see a doctor. When you notice that your libido and your hormonal you have hormonal imbalance, like you notice hormonal symptoms, you should visit a doctor. Or if erectile dysfunction persists for a week or months, you should see a licensed practicing doctor, right? Don't just go meet any doctor. Don't just go meet anybody that is being a doctor. You should visit someone who is licensed to practice medicine, right? Then, to conclude all of this, erectile dysfunction is more than a bedroom issues, right? Sometimes it's the body way of saying something needs attention, and the earlier it is addressed, the better the outcome, right? So instead of suffering in silence and depending on dangerous self-medication, herbal mixtures, and all of that, you should seek proper medical attention, seek proper medical guidance, so that you actually know what the issue is and how to handle it. Now, if you like this video, if you like what I'm doing, feel free to share to your friends, subscribe to our YouTube channel, like our post, drop a comment, and we'll be here to see you and answer your questions, because here in Talk Health with Us, we talk about health openly, honestly, and without shame. See you in our next video. Bye.